Chemotherapy is a powerful treatment for cancer. It uses special drugs to kill cancer cells or stop them from growing. These drugs work throughout the body. It's often used with other treatments like surgery or radiation. The goal is to cure cancer, slow its growth, or relieve symptoms. Chemotherapy is a cornerstone of modern cancer care. Chemotherapy drugs are not all the same. They're grouped by how they work and their chemical structure. This allows doctors to choose the most effective drug or combination for each patient. Alkylating agents are one of the oldest types of chemotherapy drugs. They work by damaging the DNA of cancer cells. This prevents them from dividing and growing. Examples include cyclophosphamide and cisplatin. Antimetabolites are another group that interferes with DNA and RNA synthesis. They essentially trick cancer cells into using them as building blocks. This disrupts cell division and leads to cell death. Methotrexate and 5-fluorouracil are common antimetabolites. Topoisomerase inhibitors work by interfering with enzymes that help DNA unwind and replicate. This disrupts the cell cycle and can trigger cell death. Examples include doxorubicin and etoposide. Plant alkaloids are derived from natural sources and interfere with cell division. They target microtubules, which are essential for cell division. Vincristine and vinblastine are two examples of this class. Chemotherapy drugs kill cancer cells but can harm healthy cells. This causes many side effects. Researchers are developing targeted therapies. These treatments attack cancer cells, sparing healthy ones. This reduces side effects and improves outcomes. Targeted therapies are a significant advancement in cancer treatment.
Chemotherapy drugs work in various ways to destroy cancer cells. Understanding these mechanisms is key to developing effective treatment strategies. One primary mechanism is DNA damage. Some drugs directly damage the DNA of cancer cells, preventing them from replicating and leading to cell death. This is akin to sabotaging a factory's blueprint, halting its production. Another mechanism is cell cycle arrest. Certain drugs disrupt the cell cycle, which is the process cells go through to grow and divide. By interrupting this cycle, these drugs prevent cancer cells from multiplying. Apoptosis, or programmed cell death, is another way chemotherapy drugs eliminate cancer cells. Some drugs activate pathways that trigger cells to self-destruct, effectively dismantling the cell from within. The choice of chemotherapy drug or combination depends on the type of cancer and its specific characteristics. By understanding how different drugs work, doctors can tailor treatment plans to individual patients. This personalized approach enhances the effectiveness of therapy.
Section 5. Administering chemotherapy, methods and cycles. Chemotherapy can be administered in various ways, each with its own benefits and considerations. The most common methods include intravenous or IV, oral, and intramuscular injections. Intravenous chemotherapy involves delivering the drugs directly into a vein. This ensures quick and efficient absorption into the bloodstream, allowing the drugs to reach cancer cells throughout the body. Oral chemotherapy involves taking medication by mouth. This is generally more convenient for patients as it doesn't require regular hospital visits. However, not all chemotherapy drugs are available in oral form, and absorption can vary. Intramuscular injections involve injecting the drugs into a muscle. This method is less common but may be used for specific drugs or situations. The muscle acts as a reservoir, slowly releasing the medication into the bloodstream. Chemotherapy is typically given in cycles, with periods of treatment followed by periods of rest. This allows healthy cells time to recover while preventing cancer cells from developing resistance to the drugs. Section 6. Intravenous chemotherapy process and considerations. Intravenous chemotherapy is a common method of administration. It involves delivering the drugs directly into a vein, ensuring rapid absorption into the bloodstream. Before starting IV chemotherapy, patients typically have a portacath or PICC line inserted. These devices provide convenient and long-term access to a vein, reducing the need for repeated needle sticks. During treatment, patients receive the chemotherapy drugs through the IV line. The duration of each session varies depending on the specific drugs and dosage. Nurses and other healthcare professionals closely monitor patients for any adverse reactions. IV chemotherapy allows for precise drug delivery and quick distribution throughout the body. However, it does require patients to visit a hospital or clinic for each treatment session. Patients receiving IV chemotherapy are advised to stay well hydrated and maintain a healthy diet. It's important to report any unusual symptoms to the healthcare team promptly, as this allows for timely intervention if needed.
Section 7. Oral and intramuscular chemotherapy benefits and challenges. Oral and intramuscular chemotherapy offer alternatives to intravenous administration. Oral chemotherapy allows patients to manage treatment at home. However, absorption can be unpredictable. Intramuscular chemotherapy involves injecting drugs into a muscle. This method provides a slower, sustained release. Discuss options with your doctor to find the best approach.
Section 8. Common side effects of chemotherapy and their management. Chemotherapy drugs can affect healthy cells, leading to side effects. These side effects vary depending on the type and dosage of drugs used, as well as individual sensitivity. One common side effect is fatigue, which can range from mild tiredness to extreme exhaustion. Staying active as tolerated, pacing activities, and getting enough rest can help manage fatigue. Nausea and vomiting are also common side effects. Anti-nausea medications can help prevent or reduce these symptoms. Eating small, frequent meals and avoiding trigger foods can also be beneficial. Hair loss is another well-known side effect of chemotherapy. While distressing, it's usually temporary, and hair grows back after treatment ends. Wigs, scarves, or hats can help cope with hair loss. Chemotherapy can also affect blood cell production, leading to a weakened immune system, anemia, or easy bruising. Medications and blood transfusions can address these issues, and avoiding close contact with sick individuals is crucial. Section 9. Addressing more serious chemotherapy side effects. While most chemotherapy side effects are temporary and manageable, some can be more serious and require prompt medical attention. Chemotherapy can damage the lining of the digestive tract, leading to mouth sores, diarrhea, or constipation. Maintaining good oral hygiene, staying hydrated, and eating a bland diet can help alleviate these symptoms. Some chemotherapy drugs can affect heart function, causing problems like cardiomyopathy or arrhythmias. Regular heart monitoring is essential, and medications may be prescribed to manage heart-related side effects. Certain chemotherapy drugs can also damage nerves, leading to peripheral neuropathy. This condition can cause numbness, tingling, or pain in the hands and feet. Medications can help manage nerve pain, and physical therapy may improve balance and coordination. It's crucial to report any unusual or persistent side effects to the healthcare team immediately. Early detection and intervention are key to managing serious side effects and preventing long-term complications.
Section 10. Chemotherapy's impact on fighting cancer, remission, and life extension. Chemotherapy plays a crucial role in fighting cancer, offering the potential for remission, tumor shrinkage, and life extension. Remission occurs when cancer is no longer detectable in the body. This can be a significant milestone in cancer treatment, offering renewed hope and improved quality of life. However, it's essential to remember that remission doesn't always mean a cure, and regular monitoring is crucial to detect any signs of recurrence. Even if complete remission isn't achievable, chemotherapy can shrink tumors and slow cancer growth. This can alleviate symptoms, improve quality of life, and extend survival time. Chemotherapy can also be used as palliative therapy, even in advanced cancer stages. In these cases, the goal is to relieve symptoms, improve comfort, and enhance the patient's overall well-being. The success of chemotherapy varies depending on the type and stage of cancer, the patient's overall health, and other factors. It's important to discuss realistic expectations and treatment goals with the healthcare team.
Section 11. Conclusion: importance of personalized cancer treatment. Chemotherapy is a powerful tool in the fight against cancer, offering various options to target and destroy cancer cells. From traditional chemotherapy drugs to targeted therapies, the field is constantly evolving, leading to more effective and personalized treatment approaches. It's crucial to remember that every cancer case is unique, and treatment decisions should be made in consultation with a qualified oncologist. They can assess the individual's specific needs, consider potential benefits and risks, and develop a tailored treatment plan. Open communication between patients, families, and the healthcare team is vital throughout the treatment journey. Asking questions, expressing concerns, and actively participating in decision-making can empower patients and improve their overall experience. Cancer treatment is a complex and ever-evolving field, but with ongoing research and advancements in personalized medicine, there is hope for a brighter future for cancer patients.